Our physical therapist, Charlie Jones, is joining us today. We're talking about one of the most common problems that we're seeing today, and that is knee pain. There's nothing worse than when your knees hurt.
Oh, that's right. I mean, the knees support everything. It's kind of interesting, Rachel. When I was really doing the research for this, I really didn't realize how many people had knee pain. Now, I know in my practice I'm seeing more and more every day, and I just really kind of thought that was a consequence of more aging population. But actually, I'm seeing knee pain in people in their 30s and 40s now, and we're not talking about knee pain that necessarily comes from injury, strain, sprains, anything like that, or fractures or infection. We're talking about people that haven't had any of that are coming in with knee pain.
Now, surprisingly, what we're finding out is this is related to hips, possibly?
Yeah, that's the reason I wanted to present this today. There's new research available that lets us know more about what's happening in the knee. Let me give you a little bit of just quick anatomy. The knee has 3 bones associated with it. It has 4 ligaments, 2 major tendons, and 2 cartilages. And all these have to work in synergy or stay aligned. And if that doesn't happen, then you have knee pain. Well, what we found is that as people age, and I don't necessarily mean 60s or 70s, but as you get a little age, start getting some soreness in areas, and that alignment changes, and they start assuming a typical bow-legged appearance. And if you look, you'll see it. It typically affects women more than men, but that bow-legged appearance puts more pressure on the inside of the knee. And what researchers have found that in the past, what we've done to help these folks is exercise for the knee and thigh muscles. And it's worked well to reduce the pain. The problem is it hasn't helped anything about the progression of the disease. So in the last year, researchers in Washington State and the University of Iowa have been doing research on what part the hip plays, because the hip muscles actually control the pelvis. And if the pelvis is out of line, it directly affects the knee alignment, and it's that knee alignment that causes, or asymmetric alignment, that causes the pain.
Now, is this something we should tell our doctor about? If we're suffering from knee pain, are they going to know to check our hip alignment necessarily?
Well, not necessarily. That's why we're talking about today. Is one of the reasons we do this program is to bring new technology and new research, and it is new. Most physicians and physical therapists today, they're aware of the hip, but they don't necessarily connect the two.
Okay.
So the reason we're talking today is the hip muscles, specifically those on the outside of the hip that affect walking, have an effect on the pelvis and then the knees. So what I'm advocating along with the researchers is that we start looking at the hip as a source. It's interesting, over 90% of the people that present with knee pain also have hip weakness. So there's got to be a connection. And they found that, the researchers have found that 80% of the people that get the exercises for the hip actually do get reduction in pressure in the knee, which is of course the cause of the pain. So we're advocating some very simple exercises similar to the ones you do if you have hip surgery. Standing using the elastic exercise bands.
Oh, yes.
Leg out to the side with the knee straight, leg out to the side, leg to the back, maybe a marching type exercise with the bands. Pretty simple standing. Sitting, rotating the hip in and out, or the leg in and out to get the rotators of the hip. And when you get a little stronger, lunges, maybe even some squats would maintain or increase the hip strength. Not difficult at all. The thing that we want to be more aware of is that since these people have knee problems to begin with, they probably have some alignment issues. And these exercises are going to be awkward. They're going to be a little hard to do. Subsequently, you want to proceed slowly, because you don't want to strain anything, make it worse.
Right.
And if it doesn't get better in a couple of weeks, I always advocate see your doctor or your physical therapist, because it might be, and you want some more advice. So the reason we wanted to present this is a lot of knee pain out there. As many as 27 million people, it's estimated, have this type of knee pain.
So check your alignment, folks, with your doctor or your physical therapist. And here's the information for Charlie Jones. He is located at the 2nd North Park in Suite 102, 877-4599. Get you more information. Of course, this is at WDEF.com, all of this information on how you can reach Charlie. So stay with us for that, and also stay with us for Half Off Thursday, which is coming up next.